Hey everyone, welcome to the functional movement assessment. Starting out lying on your back with your knees bent and feet flat. Be sure that your head is well supported by a pillow, a blanket fold, maybe a yoga block. Your knees bent, feet flat is called a hook lying position. This helps your back to be in a more neutral, relaxed position. Starting out with abdomino-diaphragmatic breathing, place your hands on your belly right below the rib cage. Draw in a deep breath. Feel your belly rise. And exhale. Feel the belly fall. Do that several times. Notice if your belly is the primary thing moving and your chest stays quiet. Lengthen your breath 4 to 6 seconds long in each direction. Notice your central nervous system calming down as you focus on deep breathing. This is because you're stimulating the vagus nerve. This helps your parasympathetic nervous system allow for more relaxation, digestion. And then now move the pelvis forward and back into pelvic tilt. You can place your hands on your lower belly or down onto the floor. And tuck your tailbone under so that you imprint the lower back flat into the mat or flat into the blanket. This is called posterior pelvic tilt. Rock the pelvis forward, arching your lower back to create a little bit of space under the lumbar spine. This is called anterior pelvic tilt. The rest of your body is not moving too much. Your rib cage and your thoracic may be lifting and arching or tucking and imprinting. But what I want you to do is observe. How does your back feel with this motion? Does it feel better in one direction or in another? Are there symptoms of discomfort, pain, or stiffness in one direction or another? And then rest. Open your feet apart a little bit wider than where they are. Place your hands out into a T or on the belly, either one. Now begin to rock your knees over to the right and turn your head to the left, feeling the stretch in the side waist and the rib cage. And then switch. Knees go to the left, head turns to the right. Feel the right rib cage. And continue rocking your knees back and forth into this windshield wiper movement. Notice how your hips feel, your side waist, the lower back, and the rib cage. It may feel great, like your body needs this. It just needs that gentle myofascial movement. Or you might feel symptoms, sciatic symptoms, hip pinching. There could be a whole host of things. I just want you to take the time to allow your body to communicate with you and listen to it. Finish out your last one on each side, and then heel toe your feet back to the middle. Now, draw your right knee into the chest. This is called hip telescoping. As you pull your right knee into the chest, compress your hip a little bit by really increasing that bend. This is hip flexion. And notice if you feel a pinching sensation or congestion in the joint. You can even rock it or oscillate it up and down. And then move your knee side to side. Create a little circle clockwise a few times. And counterclockwise. In orthopedic medicine, this is called the scour test, where actually you would draw your knee in and compress the joint by pulling the knee down in towards your chest more, just to see if there is a pinching sensation or irritation in the hip joint. This can help to identify torn labrum in the cartilage of the hip. It can identify an impinged psoas muscle. by having some groin discomfort, there's a whole host of things that you can learn from this test. Okay. All right. And then switch. Bring your left knee into the chest. Same thing. Compress it with full hip and knee flexion. And then moving it side to side, back and forth. Circling it around one way and the other. And then create a little bit more compression. Really pull on that hip knee down and see if you can produce discomfort in the groin or the inner thigh or front crease of the hip. Okay, rest. Draw your right knee into the chest again, but this time place your hands under the crease of your knee. Your left knee can stay bent, foot flat, or you can straighten your left leg, either one, whatever feels good. Now you're going to create jackknife stretch. This is straightening your right leg up to the sky and then bending it back in towards your chest. Do it 5 times. You're testing your flexibility in your hamstring and the sciatic nerve. You're checking the length and also to see if there are symptoms that provoke irritation in the buttock, the hamstring, the sciatic nerve, maybe the calf. Keep the leg lifted. Pump your ankle up and down. Flex and point your toes. Circle your foot around clockwise a few times. And counterclockwise a few times. Pay attention to what your ankle, your foot, and your leg muscles are telling you. If there's tightness in the shin muscle, the calf, the peroneals on the outer part of the leg, or the tibialis posterior on the inner part of your shin. And then wiggle your toes independently of each other. Can they move independently of each other? Curl them down and in into toe flexion. And then lift your toes up, spread them apart into toe extension. Good. Rest. Hug left knee into the chest. Place both hands under the crease of your knee and begin with jackknife stretch. 5 to 7 reps. Work on straightening and bending. Straightening and bending to feel the length in your glute max, hamstring, gastroc calf muscle, and the Achilles tendon. Also notice what's happening with the sciatic nerve. Keep your leg lifted and then begin ankle pumps. Flex and point your toes up and down, up and down. Circle your foot around and reverse. Move the toes. Wiggle the toes independently of each other. Curl them down and in into flexion. Lift them up into extension. Spread the toes apart into abduction. Just giving care and attention to each and every small joint of your foot. And just notice what your body is experiencing. Rest your foot back down onto the mat and do a little windshield wipers. Again, rock your knees side to side. Start deciding what poses or stretches feel good to you. What gives you relief? What can you tell that your body needs? And then also recognize what movements and positions and stretches create some discomfort. So this all is a process in the functional movement assessment is a process called interoception. It's increasing your body's ability to detect harm, injury, pain. It's your internal radar. Okay, good. Hug both knees into the chest, double knees to chest stretch. This creates flexion in your lumbar spine, your hips and your knees. It may feel good for some, it may feel bad for some. Rest your feet down onto the mat. And then remove your block or pillow or blanket from behind your head. And then you're going to curl tailbone under, lift up into a bridge, creating hip extension, knee extension. As you lift your hips up, you're going to feel this in your glutes, hamstrings, lower back, and then rest back down as Neo crosses under the bridge. That was great, Nancy. Do it again. 3 to 5 more times. Just bridge up, hold it for 5 seconds, and observe. How does your body feel with bridging? We remove the blanket fold and the pillow from behind the head because we don't want to increase flexion, compression in the cervical spine. That's why we keep the head flat. But notice, does this feel like it's strengthening your glute muscles, like activating and bringing blood flow into your glute max muscles and hamstrings? Or does it feel painful or irritating? Right in the center of your buttock is the piriformis muscle. Do you feel like there's a symptom that's starting to light up? So you want to take note for each of these movements and make a mental note. Good, one more. And as you bridge, tuck your tailbone under, brace your core super tight. See if this feels better just by engaging your core while you bridge. Does it feel more stabilizing or does it not feel as good? Okay, rest, do your favorite stretch, either double knees to chest or windshield wipers, either one. Place the pillow or the blanket fold back under your head for neck support. Place your legs however you feel most comfortable, and then float your arms up to the sky overhead to the back wall as far as you can. Let your rib cage rise, and then exhale as you float your arms right back down next to your hips. And do that 5 to 7 times. This is called glenohumeral flexion. Glenohumeral or shoulder flexion. So your shoulder joint is actually 4 joints. This is your glenohumeral joint moving, primarily the ball and socket. As you move your shoulder up into flexion and you go to the end range, notice if you feel a pinching sensation in the shoulders. Do you feel any dull ache referred down into the deltoid? If you do, that could indicate that you have tight myofascial structures, or you might have a little rotator cuff impingement. Okay. And then what I want you to do now is open your arms a little wider as you reach your arms up overhead. Reach your arms more like into a V position to create some more space in the glenohumeral joint. And as you move your arms up and down for just a few more reps, tuck your tailbone, brace your core, press your rib cage down into the mat. Notice how that restricts your motion from going as far, but it creates more stability. Transition to pec flies. Reach your arms up to the sky, connect your palms together, and then separate your shoulder blades apart, like you're diving your arms into the ceiling. This is called scapulothoracic protraction. Now, open your arms out wide, all the way down to the ground if you can. Squeeze your shoulder blades together into scapulothoracic retraction. Move your arms out and in 5 to 10 times. Observe how your shoulders feel. Increase interoception. Not only should you notice what's happening at your joints and your muscles and your nerves, but think about your circulation, how this feels. Is there numbness or tingling happening? Rest. Arms down at your sides. Nod your head right and left into full range of motion. Your head is supported against gravity by being down onto the pillow. And as you rotate, notice if there's stiffness, restriction as you go to the end range. I feel it. So you want to just go to your edge, but not really past it. And just decide how your neck feels today. Sometimes it just depends on how you slept, what position your neck was in. Come back to the midline and then nod your chin down and up. You're nodding yes and no. I mean, yes, we did know already by going side to side. And here you're creating cervical flexion and extension. Move slow. Do you notice what your body's telling you? It feels good just to move the neck. It feels stiff. You might feel a semblance of a headache. You may feel numbness and tingling in the fingers. So all of these movements and isolating specific joints in the body for the functional movement assessment gives you a ton of information that you don't want to just blow past. Listen to it. Find a position that feels good and neutral to your neck. Good. Take a deep breath in. Exhale fully. One more deep breath in. And exhale fully. Transition onto all fours now. Roll to your side to sit up. In 4-point position, take advantage of props. I'm a huge fan of props, using blanket fold under the kneecaps, just so you have less compression in those joints, the patellofemoral joint and the tibiofemoral joint. Those are your knee joints. And then use yoga blocks, grips, bolsters, whatever you need to support your hands, your wrists, those small joints of the body. And once you're bearing weight through your hands and through your knees, move freely and organically. You can do this by rocking back and forth, hips towards your heels, and then shoulders past your fingertips. You can add some circles, sweeping your hips around clockwise and counterclockwise. Allow your head to hang down. The weight of your head drops down with gravity. Just loosening up those neck muscles, continuously breathe. And notice how your wrists feel, your fingers, your thumbs. Transition to cat and cow, creating flexion and extension in your spine. Cat, tuck your tailbone under, tuck your chin under, rounding your spine into flexion, pushing the floor away from you and separating your shoulder blades apart. Cow stretch, lift your tailbone up, let the rest of your spine follow, lifting your head and neck last into cervical extension. And then reverse. As you're creating this spinal hygiene of spine flexion and spine extension, go to your edge, don't go past it, recognize what your body tells you. I like this pose, I don't like this pose. This feels stiff, this feels good. My body needs this. I feel circulation moving. Circulation is moving into your discs, nerves, and muscles. You're also mobilizing what's called cerebrospinal fluid, or CSF, which goes from your brain, circulates through the brain, all the way down into your spinal canal. So just by moving your spine purposefully, you're mobilizing those tiny cells moving throughout the body. Rest. Child's pose stretch. Drop your hips down, chest down, forehead down into the mat. Surrender to the earth. Maybe flex your wrists in the opposite direction they were just in. You could circle them around in one way and reverse. Walk your hands over to the right side of your mat, opening up the left side waist, creating a gentle lateral flexion stretch. Maybe your spine hasn't been in this position in a couple of days. Breathe into that left rib cage, the left intercostal muscles of the rib cage, the left latissimus dorsi and shoulder. One more deep breath in. As you exhale, switch sides, walking hands over to the left side of the mat and shifting your hips to the right. Opening up the right side waist now. Notice, does this side feel better, worse, or the same? Inhale deeply, exhale fully. Modify whatever you need for your hips and knees or your feet. Rise up, all fours, find neutral spine. So if you can just imagine that I balance a hot cup of coffee on your lower back. Nancy, can you tilt your camera up about 2 inches? Good, better. A little cup of espresso on the back of your neck, and then hot tea between your shoulder blades. Your spine would be pretty darn straight. Hold that neutral spine and then bend your elbows so that they bow outwards. This creates internal rotation of your shoulders. So you're going to bend your elbows a lot, almost like you're doing a push-up. So bend your elbows, drop your chest down a little bit. Yeah. And then straighten your elbows fully by spinning the biceps forward. This creates external rotation of the shoulder joints. Do it again. Bend and straighten, bend and straighten. This is called an arm spiral. In weight bearing, you're mobilizing your humerus bone, your radius bone, and your ulnar bone. You're mobilizing little joints in the wrists. and notice how this feels. Are you wondering, why can't I straighten my elbows all the way? Why do I feel like there's still a little bend? It may be because you're not straightening your elbows and utilizing that range of motion regularly. Okay. All right, good. Rise up onto your knees into a tall kneeling position. And in this position, just shrug your shoulders up, roll them back, give yourself a little shoulder massage. Clasp your hands behind your back, opening your pectorals, chest muscles. Look straight ahead or up to the sky. Take a deep breath in. As you exhale, maybe you could lift your hands up a little higher, really feeling that stretch deepen in the deltoids and the biceps and the pecs, where you might have a lot of tension. So again, only go to your edge, not really far past it. And then clasp your hands out in front of you. Create scapular protraction, rounding your spine into cat stretch in this tall kneeling position, separating your shoulder blades apart. So now you're getting a big stretch in the back of your shoulders. So your hands are forward. Yep. Drop your head down into flexion. Separate those shoulder blade muscles apart. And notice which one feels better or which one feels worse. Return, all fours. Find neutral again. Balancing hot coffee, tea, espresso on your spine. Okay. Curl your toes forward towards your shins. Lift your knees up 2 inches, hover and hold. Recognize what muscles need to work to allow this to happen. Upper body strength, core strength, quad strength, rest. Even toe strength is required. Do it again. Engage, de-shrug, straight spine, lift knees, 5-second hold. 5, 4, 3, 2, 1. Take a break. Rest either in child's pose or a tall kneel. Choose your favorite restorative stretch position. Good. In down dog prep, I said brace like at one point, but haven't really talked anything about TATD breath yet. That exercise or FMA assessment pose, it's called down dog prep, gives you a lot of information on how much strength you have available in your quadriceps, your abdominals, your shoulders, even your neck, right? So then you can use that therapeutically to build strength in your body. All right, now we're going to add on to that down dog prep by doing a few glides. Align hands under shoulders, knees under hips, straight spine from head to tailbone. Tuck your toes forward towards your shins. Lift your knees up 2 to 3 inches, and then rock. Hips back towards your heels and forth 5 times. Feel what muscles are required to make this happen. Do you have the strength available to you? Then lift your hips up to the sky into downward facing dog. In down dog, I want you to focus on pressing your chest towards your thighs. You can walk the dog just to ease into this pose. Bend your right knee, drop your left heel down. Bend your left knee, drop your right heel down. So you're pedaling your heels out one at a time. What's happening here? What's communicating with you? Hamstring sciatic nerve stretch, upper body strength, rotator cuff impingement. Is that there? Neck pain, neck relief. Lots of things happening. Rest your body down, knees down, chest down, forehead down into child's pose or a tall kneel. 5 breaths. Roll the wrists out, whatever you need. Transition to prone. Prone lying is on your stomach. Judge, if you lie flat on your stomach with nothing under your abdomen, you may already know this. Decide whether or not your back is happy or sad. Lying flat on my stomach generally doesn't feel good unless I have a cushion under my abdomen placed directly between the rib cage and the pelvic bone. So that pillow should really be right in that middle line between the rib cage and the pelvic bone. This is quite a big bolster, but I usually like to use a pillow. And then once you're in prone, breathe first. Inhale and exhale. Decide if you need to make a change. Do you need to remove the pillow or a couple of layers of the blanket, or do you need to add more layers? Does your back start talking? Hands go under forehead, rest your head all the way down onto the ground so that your muscles are not contracted in the back. Just pretend you're getting ready to take a nap on your stomach. One way that you could even envision is pretend you've had surgery on the back of your glute or your neck or your shoulder blade, and the doctor says, you can't lie on your back. You can't lie on your side. So pretend that you've got to sleep and then adjust everything around that so that you can find comfort. Inhale deeply, belly rises into the pillow, blanket, fold, or the floor, but then the back rib cage rises up. Exhale fully, and then you're going to feel that fall. Are there symptoms talking? Typically, if you have any history of lumbar lower back pain, sciatica, piriformis syndrome, you could get some communication in one or both glutes, right in the piriformis. So what we're going to do now is pelvic tilt. Tuck your tailbone under, rounding your lower back. There's not a whole lot of room to do it, but there's enough. And then gently reverse, lifting the tailbone up, creating a little dip in your lumbar spine into extension. Tuck again into flexion, arch again into extension. So notice what your body's telling you as you do spine flexion and spine extension. Pelvic tilt anterior, pelvic tilt posterior. What feels good? What feels bad? What feels natural? And then relax. Bend both knees. Let your back and your glutes be loosey-goosey as you rock your feet side to side, back and forth, like a windshield wiper. Maybe you could open your knees a little wider. This creates some more space in your joints, your hips especially. But as you rock your feet side to side like a silent metronome, allow your side waist, front hip, lower back muscles, relax and move. This is freedom of range of motion. We're not focusing on stability or strength at this moment. Feel free to do this anytime you need it. Rest and straighten your legs out long behind you. Notice how your toes feel. So if your toes are pointed and the front parts of your feet, which is called the dorsum of your foot and ankle, is flat on the ground, do you get cramps in the bottom of your feet? Do you feel something in your toes? If that's you, then all you need to do is flex your feet, toes to shins, into dorsiflexion with your toes on the ground. Okay, so everyone's feet are on the ground. You just need to decide if plantar flexion, pointing, or dorsiflexion is better. And then choose that position and be still. Next, tuck your tailbone under and brace your core firmly like I were about to punch you in the tummy, which I won't, but pretend that someone's going to punch you in the stomach. So you're trying to guard your abs. Really engage them tight. Squeeze your glutes tight, and then let your glutes go without letting your abs go. Can you do it? Brace your core super tight, squeeze your glutes tight, unsqueeze your glutes, try to let your glutes go, but keep your abs tight. Do it again. Brace core super tight, squeeze glutes tight, let go of the glutes. Keep your abs tight. One more time, abs tight, glutes tight, glutes relax, but abs stay tight, and then rest. It's hard to differentiate when you're engaging your core to know whether or not you are a butt clencher, that your glutes just automatically turn on. If you're a butt clencher, you will get some more tension in the piriformis, glute medius, glute minimus, glute maximus. I've been guilty of that myself. So what you want to do is engage your core and just try to let your glutes go and work on that more. All right, same thing, but now we're going to engage pelvic floor. Tuck tailbone, brace core super tight. Draw the muscles of your pelvic floor, otherwise known as Kegels, up as you breathe. Don't hold your breath. Engage the Kegels, but could you let go of your glutes? Don't over clench the glute max. Try to engage the Kegels and the abdominals without the glutes. Release. Again, tuck, brace core abdominals, engage Kegels firmly. Let the glutes go. You'll know if you're engaging them if you squeeze the glutes and they're already squeezing. It's just that awareness. Breathe. Release. This process that you're doing is called disassociation. You're learning how to engage certain muscles and shut off other ones. Okay? Sit back into child's pose. Keep your bolsters, blankets there. Just sit back, hips back, chest down, giving your spine some flexion. Because I know prone position is not the most comfortable for most. Some people love it and they need it to get their back pain under control, but the majority of people feel better in flexion. Deep breath in, full breath out. And return back into prone. Once again, point toes or flex toes, whatever feels best. Hands go under forehead. Tuck your tailbone, brace your core. And now we're going to do terminal knee extension. It's called knee lock. You're going to push your toes down into the ground on the right side, so much so that your right kneecap pops up off the ground. Drop it back down onto the ground. Pop your kneecap up, pop your kneecap down. So just move that right knee up and down. Terminal knee extension activates the deepest core muscles in your knee joint. In particular, here it's called the popliteus in the back of the knee, and then the quadricep in the front of the knee. Keep bracing your core abdominals. Do 3 more. 2 and 1. Rest, relax, and switch. Tuck, brace, lock your left knee by pushing your toes down into the ground. Allow that kneecap to pop up and rest back down. Actively do this terminal knee extension. So I prescribe this if anyone's had knee surgery, knee injury, torn meniscus, ACL, PCL, whatever. They have to re-educate their knee to be able to do full extension. If you lose extension, it affects your gait. You won't be able to walk with a fully straightened knee. And then your quads will weaken. So condition your knee to be able to reach this terminal knee extension. A very strong term is called knee lock or lock your knee. Okay. All right. Rest, windshield wiper, side to side, back and forth, whatever you need in prone. Let's test your strength of your glute max. Glute maximus is innervated by S1 nerve root. So if you have any history of L5-S1, disc bulge, herniation, pinching, stenosis, it doesn't matter. That nerve can weaken the muscles over time. Tuck first, brace core second, lock knee third on the right side. Toes are down into the mat. Now, lift that right foot off the ground 2 to 5 inches, up and down. Let your foot touch the ground and lift your leg into full hip extension 10 times. Don't let your knee bend. I want you to clear your thigh bone off the ground. If you can't, then you have a 0 out of 5 muscle testing score. If you can, then good. You have strength in glute max and S1. Rest. Switch. Tuck tailbone, brace core. This time you do want to squeeze your glute cheek. Lock your knee, brace, and lift it up 2 to 10 inches off the ground. 10 repetitions. Do you have knee extension, terminal knee extension, the whole time? If not, and your knee is bending a little bit, but you can clear your thigh off the ground, it's okay. You have some, you may just have a knee flexion contracture. Contracture is where there's a kind of a permanent bend in the knee. Rest, shake it out. Loosen your hips side to side. You can bend your knees, rock them side, back and forth. Okay, sneak in a child's pose again, flexion, because we have to work the upper body next. So I want you to give yourself a little bit of a respite break. Return 4-point position for Cobra. With your hands positioned under your shoulders or armpit crease, palms are flat on the mat, head is down on the ground. Palms are flat, fingertips facing forward, forehead is down onto the ground. Okay, so you're in prone unless you're modifying. Shrug your shoulders up, feel tension in the trapezius muscles, and then shrug your shoulders down away from the ears. Keep your shoulders down the back away from the ears. Tuck your tailbone, brace your core, push your hands down into the ground and lift your chest up 1 inch or 5 or 10. Lower your chest down. I want you to do that 5 to 10 times. Here you're doing passive spinal extension. You're using your hands to push your chest up. Notice how your back feels with this. Good, bad, or no change. Maybe you could go up higher. See what your edge is. If your back is like, nope, then don't go higher. Spinal extension gets lost in our bodies over time, unless we purposefully do it. Okay. Rest for a moment. Turn your head to the right. You can tuck hands under your forehead or rest them down at your sides. Just find what feels good. And breathe. Breathe into your neck rotators. Even with this, notice how much range of motion you have available in your neck. If you don't use it, you lose it. Bring your head back to the middle. And then with your arms positioned like cactus arms, your elbows are bent at 90 degrees. Your shoulders are bent at 90 degrees. Forehead is down in the midline. You're going to tuck tailbone and brace your core tight. Lift your arms up off the mat 1 inch. Now, can you lift your head up and your chest up off the mat 1 inch? This is called active back extension. Lower your body back down with control and do it again. Lift your head, chest, arms off the mat actively and lower it back down. And if you can't, or if it hurts your back, you don't have to do it, but know that your back strength today is 0 if you cannot lift your chest up. So you're testing your back strength actively versus passively. You're no longer using your hands to assist. If you can do this 10 times, you're activating muscles in your entire back body. Last 2. Rest. Turn your head to the left. Drop your arms down at your sides. Breathe into the neck. Breathe into the lower back. And then just think about how you feel. Is this statement true for you? I love the prone series. It feels really good. Or is this other statement true? I hate the prone series. I don't like it. It doesn't feel good. I feel weak. I feel pain. Or this third statement. This is a piece of cake. I've been doing this for years and it's just part of my repertoire. Okay, sit back into child's pose, relax and release into flexion. You can also do a tall kneel, just whatever feels good to you to bring you back to homeostasis. Homeostasis is just like a safe place. Okay, great. All right, now set up your yoga couch for Shavasana. We're going to do a guided meditation. But today you just completed the functional movement assessment. This is what I do with patients one-on-one when I see them, because I want to see if I can provoke symptoms in their body, not only in their hips and legs for low back pain, but in their upper body, their neck, their shoulders. But the FMA is designed to be an assessment, a treatment, and as a home exercise program. So think about your nemesis poses, your nemesis exercises, and talk to me about it later. Just say, why is it that my body wasn't feeling good with this? And if you have a yoga strap, let's take a little bit of time just to stretch hamstrings, IT band, inner thigh. Reposition your camera so I can see you. Tilt it up a little or down a little, just so I can see you. And then create an environment for a therapeutic landscape. So that can include lights off, music on, essential oils, all those things. Right hamstring stretch, right leg up to the sky, gently pull on that rope. Your left knee can be bent or straight, your choice. I want you to breathe intentionally through the glute maximus, hamstring muscle, popliteus muscle, gastroc muscle, Achilles tendon, plantar fascia, toe flexors, just by pulling and creating tension. Deep breath in, full breath out. Guide your right leg over the midline gently without losing that straight knee. Anchor your pelvis to the mat with an imaginary seat belt so that now you're going to feel the stretch on the outer lateral thigh, knee, ankle, and foot. Breathe into the glute medius, glute minimus, iliotibial tract, vastus lateralis outer thigh muscle, peroneals or fibular muscles on the outer shin. If you flex your foot and straighten your knee, you're going to feel it intensify even more. Guide your right leg out to the right side, but bend your left knee and let it fall out. It's called the bent knee fall out. It helps stabilize your pelvis better. As you stretch your right inner thigh, try not to lose that straight knee. And could you draw your right foot closer to your right shoulder? Really feeling length in the adductor magnus, pectineus, all that attached to the pubic bone. The vastus medialis oblique, that's the inner quadricep muscle. The peroneus, or not peroneus, tibialis posterior muscle on the inner shin. Some people get shin splints on the inner medial part of the shin versus the outer. One more breath. Cross right ankle over the left knee for figure four. You can either keep your foot resting and press your right knee away from you. This creates a little figure four position. Or if it's available to you, dive your right arm in between the legs and pull your left thigh into the chest. And this will stretch outer thigh, inner thigh, back thigh. Glute medius stretch, adductor stretch, glute max and hamstring stretch. Release and switch. Left hamstring up to the sky. Right knee is bent, foot flat or straight out into the mat, your choice. Breathe into the back body. Left glute max. Ischial tuberosity is the bone at the base of the pelvis where your hamstring attaches. That's the origin. The insertion is below the knee on the shin bone, your tibia, the back of the tibia. If you straighten your knee or flex your foot toes to shin into dorsiflexion, you're going to deeply intensify that stretch, feeling it in the sciatic nerve. You're flossing that nerve in its sheath if you flex and point, flex and point. Exhale as you cross your left leg over the midline of the body. Anchor pelvis down into the mat with a seat belt. Isolating left glute medius minimus, IT band, peroneals. These are your L5 muscles. So if the L5 nerve root is pinched, irritated at any time, it will cause these muscles in the outer thigh and leg to contract and get tight and sometimes feel painful. So this is just giving honor and attention to these muscles and nerves. Maybe straighten your knee a little more, draw your foot down closer towards the right shoulder, whatever's available. Find your edge and don't go past it. Engage your core as you open, left leg out to the left side, bent knee fall out on the right side to anchor the pelvis to the mat. Deep breath in, full breath out. It's always nice if there's a couch or an ottoman right there where you can just rest your leg passively, then your upper body doesn't have to do all the work. It's a really gentle, deep stretch. The inner thigh adductor muscles. Stretching and strengthening prevents injury. Inhale, exhale. Maybe straighten the knee more, draw your foot closer to your left shoulder. One more breath. Figure 4, cross left ankle over the right knee. You can either press your left knee away from you, creating external rotation to stretch your hip a little bit, or you can dive left arm in between the legs and pull right thigh into the chest, using your left elbow to push your left knee away. Little pretzel twist. Stretches, opens up that hip quite a bit. Be careful and gentle with your knee joint. And then release. Grab your bolsters, blankets, ottomans to place under the thighs. Give yourself some support. We used to use chairs in the yoga classroom. Under the legs. Set up your therapeutic landscape. Eyes shut, lights off. Essential oils are on. And then I'm going to take you through our guided meditation. Progressive relaxation. This deep relaxation meditation is in a book called Seeds of Light, Healing Meditations for Your Body and Soul, written by Elizabeth Stratton. And it offers meditations that really allow you to tap into your vagus nerve, to allow meditation and rest, digestion, healing your gut, and healing your mind. Find a comfortable position, lying down. Uncross your arms and legs and close your eyes. Take in a long, deep breath and let it out slowly. Allow your breathing to become full, deep, and relaxed. As you count from 10 to 0, allow your rational mind to rest, and you will become more receptive to the wisdom of your soul and its healing power. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. You are now very deeply relaxed. Focus your attention on your toes. Get in touch with how your toes feel. Wiggle them. You may feel a slight tingling or flow of energy. Allow your toes to relax. Allow the sensation of relaxation to gently move upward into your feet. Feel the tops, bottoms, and sides of your feet flowing with the gentle sensation of relaxation. Now gradually allow this sensation to move up into your ankles. Breathe. Continue to allow the sensation of relaxation to move inch by inch into your calves. As you allow the muscles in your calves to relax, you may feel a sensation of warmth as the blood flows smoothly and the nerves balance. Gradually allow the sensation of relaxation to continue up into your knees. Your lower legs are completely relaxed now. You are very comfortable, and your breathing is becoming more and more deeply relaxed. Allow the sensation of relaxation to move into your thighs, into your pelvis, surrounding your hips. Feel your gluteals and your lower back muscles becoming more and more relaxed. Breathe. Your entire lower body is relaxed. All the muscles, nerves, and your organs are in a deep state of relaxation. Allow this sensation of deep relaxation to move up into your abdominal muscles, throughout the ribs, the intercostal muscles, wrapping around to the middle back. Breathe deeply as you feel your solar plexus open and relax. Allow the sensation of relaxation to move up into your chest, your heart, into your lungs, and the upper back. Notice your shoulders beginning to relax, and the sensation moving down the arms into your elbows, hands, and fingers. Allow the sensation of relaxation to move from the hands back upwards towards the neck, and then your jaw, mouth, and face. Drop your jaw slightly. You can feel relaxing all of the muscles in your face and forehead, especially between the eyebrows. Your mind is resting. You can even feel your scalp relaxing. Your whole body is completely relaxed now. Your whole body is completely relaxed now, and your mind is still. Take a moment to gently allow your awareness to scan throughout your body. See if there are any areas that need to relax more deeply. Breathe, let go into these areas, relaxing them even more deeply. You may continue in this deep state of relaxation for as long as you wish. But when you are ready to open your eyes, be sure to count up from 1 to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Gently flower the eyes open. Place your hands over the heart. May our practice be meaningful. May our practice bear fruit. May the fruits of our practice benefit all those around us. The highest in me honors the highest in you. Namaste.